See, in a class, so many people with so many different outlooks, intelligences, emotions are sitting, and it's a heterogeneous group, you all know, but there is a lot of commonality in it. I could know from that, from your responses in the assignments. It has made my job quite easy, because evaluation is something which all of us has been going through life day in, day out, and I will use the technique known to everybody, what is called as the KISS technique. No eyebrows raised, keep it short and simple. And don't bore you much, I hope. So we will skip most of the aspects of evaluation known to us and concentrate on some areas which are probably relevant to bioethics. Can I have the first slide? By the way, let me introduce myself. I am a pathologist by profession, but I don't have a mundane way of looking at things. We are at the third leg of the spiral, which unless you evaluate anything, you are not going to go back to your objectives. If you are evaluating only, you know whether your objectives were right or not. Suppose you are going to conduct a course on bioethics and run a course in your institution. How do you know how effective that course is? How do you formulate questions on bioethics? Taking a class itself is difficult, and you have to use methodology like Madam has said. So evaluation is going to be even more difficult. During this particular lecture, I would like to demonstrate to you some aspects of evaluation. Of course, with your own assignment which you have given, mostly written you have submitted, we will see some other forms of evaluation like viva and teacher evaluation. As a teacher or as a mentor or as a motivator or maybe as a person, how do you evaluate yourself in front of students, in front of patients, in front of others? How can you get a good feedback? Those methods are quite important and relevant to bioethics. I will be concentrating on that also. Basically, we say that evaluation is a systematic process. Obviously, it has to be built into the system. It determines whether predetermined objectives are achieved, to what extent they are achieved. And there is often a question, is evaluation and assessment same or different? What do you think? They are different. The class test which you use is an assessment. Assessment tests the learner's ability, what the student can do. Like Madam has tested your assessment, how you are doing, you can see through the games. Evaluation not only tests the students, it also tests the system. When you give a course evaluation on how effective this program was, that is evaluation, that is not an assessment. You can write anything in that. That's an evaluation of the system. Moreover, if you do a sort of an examination on what we have done today at the end, that is partly assessment and partly evaluation. So basically assessment is a part of evaluation, and assessment is as effective as evaluation. Many uses are there, like you can use for selecting students, but the most important two are the ones at the bottom, that is formative evaluation, evaluations which you do in between. You can say today we have a session of 5 or 6 hours, we can evaluate in between. In a classroom, the teacher is evaluating the student is evaluating the teacher. This happens in adult learning. Constantly there is an interplay, and in a class of 200 students, you cannot sort of evaluate them by looking at them. I can evaluate some of you, but I cannot evaluate 200 students. So you have to have a formative something. At the end of a period, you do a test. That is called formative evaluation. But certifying competence is different. Like for example, you are asked to do a project, I believe, is it not? So you may be asked to do a project or prepare a paper. Before they certify, give you a certificate of competence, you are competent in bioethics. That is a certifying thing. So both are important. The first one gives you a feedback on your learning process. The second one gives you the final authority to teach others. Now, can you give there is a handout. It's an individual task. What I will do is, we will go through one by one. There are many statements given. I want you to tell me whether it is pertaining to formative or summative evaluation, just to make the ideas clear to you. What informs the student of his progress? Is it formative or summative? Formative. It is formative, correct. Next. Success or failure? Success or failure? denoted by summative evaluation. Third, protection of society. It's an ethical question. It is both, yes. Next, incentive to learn is formative, because summative you don't, because you are certifying something, either success or failure. Next, sir. Enable the teacher to change the teaching learning methods. Formative or summative? Both. Formative more than summative, because suppose we find something is failing here, we will have to cut it out in the next program and do a different thing. Next one. Permits rank ordering of students. Both formative and summative, but more important, the final rank or grading is for a summative. So now I think the difference is quite clear. Forget the next page and please concentrate here. These are the various methods employed in a bioethics setting, teaching bioethics. Could you use written examination for bioethics testing? I think you can. What about practicals? How do you going to conduct a practical in bioethics? And observe. Is it not with a checklist or something? Yes, so practical examination is possible provided there is no subjective marking. Fine. Viva, of course, is very important, I think, bioethics, because you have to know the attitudes. And thesis and project, small projects, you can definitely use it to see the attitude. And observation, of course, that is the key, I think, in bioethics. Constant observation whether the individual is improving with each counseling or not. So each method has its own merits and demerits. Hence, the thing in evaluation is that use a judicious mixture of all. Don't say, I don't like this method, so I won't use it, because often that is a problem. And the qualities, like the same thing as objectives, the most important is relevant. Is it relevant? Suppose you are going to take bioethics for an undergraduate student in MBBS. The type of evaluation tool would mostly be something like in a written format. You need not go to the extent of having a Viva on bioethics, maybe practically not feasible. But relevant, they should know something on bioethics. Any other suggestions? Any teachers on the medical side? You have physiotherapy. You can. What about you for your students? Which will be the most relevant method which you will take for bioethics? Suppose you are asked to select one method. Practical only. All agree? Very good. That's a good consensus. Anybody who is disagreeing? On? Yes? Need a mix of written and practical, is it? Yes. That's also taken. Let's not have watertight compartments, or structure the practical in such a way that there's a written component in it. Yes, the short projects also, if there is time. But is it relevant for that course, MBBS course? Short project on bioethics, they may not find time. There are 22 subjects to study. Maybe frame it for some other subjects, some other courses where there is more time. So depending on course, the relevance of the tool which you choose is important. Basically written, we know, use short answer, essay and objective. You have formulated and supplied me these. And let's go to the next task. You can see short answer questions in bioethics which have been given to me submitted by assignments. Basically, short answer questions can be used in different ways, like completion items, definitions, but you can use label, draw diagrams, numerical problems, open questions. Can you have open questions in a short answer? You can have, for example, dramatize a conversation in HIV patient. You can say in so many words or 3 sentences. That also can be used to judge that area. Okay. You can use problem solving items, short problems. What is your opinion in disconnecting the ventilator? Give a short opinion in 2 sentences. Don't write a para. So you can, your content area you can expand over so many things and get the impact. These are the merits. There are no clues to the answers like in an objective. You supply 4 and select 1. Here he has to write what he knows. However, proficiency in language like in an essay is not that important. Large area can be covered, because even problem solving questions you ask multiple, then you can have a content area covering. Demerits, of course, is no room for a decent discussion. I think bioethics would require some essay question at some point of time to know whether they understand the concepts. If you want to understand concept, they cannot ramble or they cannot give some answer in a short answer. So you require an essay, I think, obviously you require an essay. Now, can we go through some of those? Where were we? Can you go through the first short answer question? Why the need of bioethics guidelines felt is the first question on short answer. Is it a short answer question? Why? It's a descriptive. So basic first point is clear. Short answer means maybe 2 or 3 sentences. How will you modify that? Give the most important guideline, rather than ask the entire one. Next, I think it's a good question. Agree? It's a good question. It tests a second level, comprehension level, and a good short answer question. How do research and clinical ethics differ? Dr. Ram, give only 2 reasons. And if there are 5, I don't know how many are there. Give the two most relevant things or most important ones, like that. So that's how you make it a specific. Third question, just read the question once again. Is it subjective? Recent drug trials, how recent? In the last 10 years or 5 years?
It's not very specific.
It's not very specific. There is some subject. So many examiners valuing this question will give different marks. You can't write a single answer. So this is a slight problem. Short answer often is mistaken as they will try to give an essay as a short answer. I have seen people write briefly on something. I think that is wrong. Write briefly on means actually you can write lots on it. Write short notes on this thing. That means you can write anything, but you write short note. That is a very wrong way of asking. So short answer question, you don't ask short notes. That is different. It's not notes we are asking. We are specifically asking something. Now we come to essay questions. What's your comment on this? Can you identify who are the 2 most confused people there? The person who set the questions and the person who valued the questions, because they perceived it differently. The candidates are confused. On top of that, the person who set the question and the person who is going to value it without any idea what he was thinking are the most confused. This is the problem with essay. Should we give it up? We can't give it up. Bioethics essays have to be there because it has your explanatory, narratory remarks, your ability to, even you can ask dramatize a conversation, you can ask things like write a play on, or even that way you can write. Ask these expressive skills have to be there. But then how about your objectivity? The problem with essay question, it does not solve a problem solving ability. We are not happy. Discuss everything about bioethics. What sort of question? We want specifics. But you can overcome the problems by structuring it and making problem based essay questions. I had given example in the assignment and many have submitted. I am very much impressed with that. Next page gives you what a modified essay question is. It begins with a brief scenario of a problem, followed by many short answer questions, each one carrying small marks, and every one of them has got a predetermined answer. So you have to have value points for each one. And remember, the most important point in a modified essay question in bioethics would be the second point. You should seek explanation or clarification of things or concepts in that. See, this is the problem which I had thought out. I have no knowledge of ethics, let me tell you, be frank. I somehow managed to do a thing like this. And somebody had submitted an essay question like this. Can you read it? Is there a problem addressed in any of the questions? Have they asked a concept or judgment on the part of the, I think the last one is quite judgmental. Explain the rights in an Indian context. That is judgmental. But any other short, if you want to add more questions, I think this looks more scientific, and if you are addressing to students, this will be a little confusing for them. More of their tense while they are reading and all. So I thought better would be to something a simple story like thing. So put them at ease first, then ask your questions which are easy at first. The tough ones is asked at the last, so that the candidate is not flustered. He answers what he knows. Good. So the examples of MEQs I have given for your perusal. You can go through. They are quite nice. Now we come to the third leg, the objective type questions. We all know what they are. There is a single predetermined answer. If the candidate answers, he gets the mark. If he doesn't, he doesn't get any mark. There is no subjective marking. Even a computer can do the marking. Now we know the various types, but regarding bioethics, what sort of objective type questions would you use? What sort of objective questions would you use? Would you use only the single best response type? You can use the higher levels, is it not? Reason assertion. Any other types? Let's see what each one stands and then find out at the end which would be the best one. I'll just briefly explain. You will be knowing, but briefly explain some of the aspects. This obviously is a single response question. It has 5 parts: the direction, the stem, the responses, distractors and the key. And I want you to go through the next sheet quite critically based on these rules of setting MCQs. Unlike the other short answer or essay, you can falter in that to an extent. But in an MCQ, you cannot falter while setting. See, in High Court and Supreme Court, there are cases pending many years because so many questions have to be deleted. Out of 100 questions, 50 will be deleted at the end of the entrance exam because of, so there cannot be ambiguity. So which are the cardinal rules we have to be thorough? The first most important rule is that key should be unarguably correct. The key or the answer should be unarguably correct. How can it be correct? You quote a reference or book from which you took. Whatever you say, nobody is going to believe. There can be, I know there can be questions. If there is no book, what I will do? You have to refer to some point by which you can come to that answer. Otherwise, this question will get deleted after you administer it, because the student goes to the case and says there is a very subjective thing. It is not reported in any quoted book. So that becomes unethical from a student point of view. You want to evaluate a particular learning has occurred or not. Okay, that much you are certain. Next, you are choosing one tool. You are not happy with that, you should be willing to change to another one. Okay, now I will, since this has failed, I will go to another type of question next time. This willingness in changing in evaluation is very important. Please go through the next sheet, and we will go through all the examples of the MCQs, because very critical, I think, where we stop.
Among the list given below, which is not desired as an IEC member, options are legal expert, politician, clinical expert and layperson from the community.
Is it a good question? It's a good question. Does it test a relevant learning outcome? For example, for a student, it's a must know area, is it? Yes. What is the answer? Politician. Okay. Because one of the answers is quite long, so I thought whether that was the answer. As a layman, I would go for the last one because that is a lengthy one. We will go through the rules. The key is unarguably correct in that. All the 3 are okay. What about the distractors are wrong? Okay. The stem, is it okay? Short, precise and clear. No negatives. It has the maximum wording. Okay. All the distractors are functional, parallel in content. Do you think any of the distractors, some student may not go for one of the distractors? Like politician is the answer. Some of the other distractors, students may not go. Is there any other method of finding it out? Can you ask it as a true, false? Politician is an ideal person for this thing. True or false? Test the outcome, is it not? So when you, that is where I said you should be amenable to switch to another type of evaluation tool. And key should not have any special dressing. And can we go to the next one? Next MCQ in there. Who is the ultimate responsibility for conducting a study? There is only one answer. Can you quote any book?
Yeah.
You can quote a book?
2006.
PI.
Responsibility.
Okay. So we can pass it off as a good question. Any other problem with that question? Is it numbered and all right? No, some errors are put, no? So there is no direction. You have to give proper direction and capital A, B, C, D as answers, not small a, B, C, D. Capital A, B, C, D is universal accepted. The same. Next MCQ. HIV transmission, most common mode. Yeah, there are 3 choices, is it not? I remember that. Would that be enough?
No.
You have to have 4, is it not? Minimum 4, is it not? What do you think?
The mother to child transmission too, and blood or blood products.
Do you want to give it as a choice to the student, or can we use a fill in the blank? If there is thing.
All the above or none of them.
No, what I think is, if it is a very must know area,
Sexual
then you
transmission.
use the fill in the blank.
Sexual transmission.
If that is the only answer and you want the student, it's a must know area, you don't have to give choices. He has to say. See, the Prime Minister of India is, you should not give choices. The student should know. So if that sort of is a must area, I think it's a must area. You change the question to a fill in the blank type. Next, MCQ please.
Which of the following antitubercular drug is avoided in children? The INH, rifampicin, ethambutol, and pyrazinamide.
So that's a very simple, straightforward question. There is no ambiguity about it, is it not? Because it's simple recall, it is testing. So recall questions, simple recall questions are quite easy to make. The problem solving questions in MCQ format are good, but there is always a problem that nowhere this problem should have come earlier. The student should not know about it. I will tell you an example, that Coca-Cola bottle which madam showed, no? It was a problem for most, but not a problem for one person, because that person had already seen the picture. For that person, from a problem it became a recall level of answer. So when you make problem-based MCQ, see that don't copy the problems from some book or something, because the student would have gone through that, then the purpose is not. The moment he hears the problem, it will ring, and without actually knowing the answer, he may just take. So that is something which you have to keep in mind. When you make problems, it has to be fresh problems. Shall I go to the next then? All of you to make one question, of selection type here right now in bioethics, and it should be a 1-minute task, because if I do, I understand. Some of you have not made or submitted the assignments, so at least now can you make one question? At random I will call somebody to read the question and we will evaluate, and it's a 1-minute task. You have to do it within a minute. You make a 1-minute question on bioethics on objective type. Quickly, within a minute. The time given is 1 minute. Yeah, its time is quite important. Objective type question in bioethics. Quickly you can make one. Where were we? I think somewhere there, no? Can you read?
The bioethics guidelines are prepared to safeguard the following. So I have given 4 options: A, institution; B, community; C, principal investigator; D, none of the above.
Say it again. Except should be there, no?
Huh?
The guidelines, the following are guidelines except, is it not? Read the question again.
The bioethics guidelines are prepared to safeguard the following: A, institution; B, community; C, principal investigator; D, none of the above.
What is the answer?
PI, principal investigator. No, principal investigator. None of the above. It is to safeguard the individual, patient, the community.
It is for protection of
Participant. Okay.
What was wrong in the preparation of the question?
Option.
The stem was not correct, was it? The distractors were okay, but the stem was not correct.
Who should not take
Among the following. Okay.
take an informed consent: A, ombudsman; B, principal investigator; C, research team; D, witness.
That's quite good. Anything wrong with that? I think it's quite okay. I'm happy that you could make some sort of an MCQ within a minute. Usually to make an MCQ it takes at least 5 minutes. The time factor is quite important. You have to think from different angles and discuss with others. Then only the question gets modified. So remember, whenever you make MCQs, don't do it in a hurry. The exercise was done primarily to highlight that point, that don't make questions in a hurry. You want to test different aspects in one particular topic. You want to test different aspects in one particular topic. You use what is called as multiple true false type. And here the rules of the game are like this: 1 mark for correct answer, 1 mark for wrong answer, and he can write don't know and get no marks. Now to make it more simple, I will show you an example here. Look at the first one is a true false type, simple one. Mando test is specific for TB, true or false. But with that we are not testing how much knowledge about tuberculosis the student is having, only one aspect we are testing. But look at the question here. Pulmonary TB is characterized by positive Mando test, true false don't know, evening rise of temperature, association with AIDS, involvement of apical lobe. We are testing him about his knowledge on a laboratory, on clinical science, on a complication, on a morphological finding. Various aspects in one particular thing can be tested using a multiple true false type. I think in bioethics, some areas it is as good as asking a short note on a particular topic. Now this particular type of evaluation is much in vogue in Western. If you go to PLAB or some other exams, they are using multiple true false types, so that it is comprehensive, and one area they can ask many things, and it is also very objective. So you can, in lot of areas can be covered, but at the same time it is objective. Here it is 1 mark for correct answer and 1 mark for negative. So you have to think very carefully before. You cannot just tick everything and go. Take the risk. Suppose he risks all true and 2 are false, he gets a 0 mark. So that risk he cannot take. Blind guessing is not possible. And higher levels of learning, especially in bioethics, can be tested using this format. See, here is a method where the ability to select relevant information and present it in a logical sequence is tested. The ability to select the relevant information first, you have to select the information, put it in an order and then present. For example, 4 steps in assessment are the, this has to be, can you give the answer to this question? Because we are on assessment, digesting, learning by doing, wanting to learn, learning by feedback. Would be the first one. Then learning by doing, learning by feedback, and digesting. Last will be digesting, no? Why?
Learning by feedback.
After that, what do? You change, is it not? So there is a controversy about the last 2. This is the problem with when you set higher level. You cannot quote any book here. You have to go by your experience. And these are areas which can be asked where there are 4 steps in a logical order if we can bring out. So you are, what do you call this form of learning? Let me see whether you have. Which is not recall, it is not discrimination, it is not problem solving, something more than that. It is analytical thinking. Analytical thinking, whether you can analytically think and put things in the proper place. Some of the very high levels of learning can be tested using such questions. Another format is like this. Here we supply 4 alternatives to him. Ask him to make the stem. 4 alternatives are given. Make a stem so that one of the following becomes the key. So from the candidate becomes the question setter. So you know how difficult it is to make a question setter. You have to be thorough with your knowledge and quote a reference book. So we put him on that. Now can you give a form a question? One of them becomes the answer. One of. Can you make one question? Shanti, what do you think? Yeah? Which one of the following can be transmitted through sexual contact? I think that's a good question. So now the problem is, what is the problem? Which one is the answer? Everybody appreciated this high level of, but there is no single answer. So these are quite good for giving class tests or motivating people to learn. For example, self-test, etc. Not for a final, what they call a summative examination. See, I used a stem like which disease is transmitted through blood. But another person may think which disease is transmitted through sexual contact. And somebody said which is doesn't have a vaccine. Many answers are possible. Unless you are prepared to give marks for all the answers, then don't go for such questions. But for class tests, they are okay. Now, matching type is familiar for all of you. Can you match this? If you can. Recall of facts. Good. Next one. True or false and matching type. It is not only knowing recall, you have to differentiate all these. Now you are doing that, is it not? You are differentiating matching from the other. So recall and discrimination. Multiple true false type? Different aspects of a topic. Good. Interpretative exercise, paired statements with relationship, ability to interpret data, interpretative. Completion type or fill in the blanks type. Facts, symbols, equations. This cannot be, it's not possible in a single buster. And the assertion reason type. So analysis. So now we are not familiar with paired and assertion reason types. We'll go through one example of each. Some of you may be familiar. For example, increase in maternal age, increase in genetic diseases in India. What is the relationship between these two? Is increase of maternal age related with increase of genetic diseases in India? Or is increase in maternal age causing decrease of genetic disease in India, or are they unrelated? So we ask the relationship between these two statements. Again, remember there has to be only one answer. Cannot have subjectivity when you use that. So this requires a synthetical ability of the person. And assertion reason. There is brain drain from India. Do you agree? Is it true or not? True. There is fall in standards of medical education in India. True or not? Are they related? There is brain drain from India because there is fall in standards of medical education. Is the reverse possible? So this is just a higher form of true false type. Ask him to find out whether this is true, and then the relationship. Okay, so this type of questions I think are more applicable in bioethics. Now we go to the next step. Now you have all the types of questions with you. How to design a question paper. You have designed a question paper. In 5 minutes I will cover the whole thing. You cannot design a question paper primarily because the design of a question paper is already done. It's a policy decision which involves a college, a curriculum committee. They tell you how many sections are there, how many papers are there, how much mark for each paper, how much time for each paper, how many questions in each one. This is all pre-decided in the curriculum. That is already given to you. All you can do is make questions on that. While formulating questions, these are the things which are important. You look whether the question is within the syllabus. There are different types of questions you are going to use, whether they are from the must-know area, and majority of the questions should target the average student. So must-know area if you ask, then the question should be simple also and target the average student. These are cardinal rules in blueprint. Here is an example of a blueprint. What the blueprint shows, in one axis you can see the different systems are written, in the other axis the type of questions used and the marks allotted for each type of question is put. So you have to prepare something like initially and then prepare the questions on each topic. So first the design is there, then you design the question paper like this. Suppose for example ethics, there are different topics. Different topics of ethics are put in the x-axis. In the y-axis, how many essays, SAQ and MCQ. In each topic, which topic you are going to ask the essay. You decide, pre-decide and put the marks there. How many marks per essay. Which topic you are going to ask the SAQs, you put the marks there. Then MCQs, which all how you are going to distribute among the various topics. Finally, you put the total. So that you are covering all the content area in the bioethics. You are covering all types of questions, and there is a judicious mixture of the type of questions and the content area. You have to design this first, then start making questions. So the most relevant area to ask essay question is which one? Then that is when you ask yourself that question. So you will ask yourself, essay where, in which topic should I ask the essay on? That question otherwise you will never ask. You will simply make a question and then just administer it. Understand? So the most important topic should carry the most number of marks. Less important topics, less number of marks. So once you make a blueprint, the rest of the rules will automatically follow. Once you make the question paper, now the questions are made according to the blueprint. Next is to check whether each question is according to the rule. For example, does it test an outcome, important outcome? Are they grouped together properly? You make so many questions. Are the MCQs together? Are the SAQs together? Are the essay questions? Because the candidate is seeing, he has to write it in an easy manner. Is there overlap between MCQ and the other type of questions? Is there repetition from previous years? Sometimes, so we have to check at the previous question papers. Then clarity, language, length of answer and marking scheme. Sometimes, most often, you will give 1 mark for an essay question. Like the question will be something like an essay, so much can be written, but marks will not parallel that. So each question you have to check these aspects and whether the question can be completed in stipulated time. And is it comparable to previous? Some students will come and complain. So compared to previous year, this is very tough, very tough. So always check the previous question papers, no repetition, and it should be comparable. Now, item card is something which designs where you make a question and you can write this thing. Now, or even in schools, for especially in ICSE syllabus, they follow the item card because parents go and fight, no, why my child didn't get this mark, the other child got. So then they say, we look at the value points, he has not written the value point. Then they come and, what is this value point? My wife came and asked me, value point. Then I told her, see, value points is something, different points for different, carry different marks. 1 point carries 1 mark, another point carries 2 marks, another point carries 3 marks. So they have value points. This is very important, and this has to be written before the paper is administered and valued. So they do that so that they can explain like that. So this is something, because especially bioethics, a subjective valuation is going to come. It will be very subjective. They will write all nonsense, they will ramble, and you have to pick out which are the value points, are they there, and give the marks. So to summarize, making a question paper is a team effort. One person cannot do. First, the syllabus, other things are decided by a panel of experts. Then maybe in a department you discuss and formulate how the questions have to be prepared. Each person prepares in a different topic. And finally, after administration, you have to evaluate the success or failure of the questions. Now the next, coming to practical examination. Now bioethics, somebody said practicals is what you want, is it not? So we will concentrate on this. Now initially the mode of practical examination everywhere, even we have undergone, is it not? How was your chemistry experiment in pre-degree or pre-UC, how was it done? You did something, you mixed something, there was some color, somebody came in the end and saw some color and marked. Did anybody watch you? How much measurement you did? Nobody did. So only the product was tested, the process was not tested. And we feel unhappy. We feel, as students, we feel unhappy. If the examiner is sitting and watching, you want to show him you know how to do these things. This is how the concept of objective structured evaluation came up. You can see in the picture, there is a candidate examining the patient, and the examiner is even more interested than the candidate, looking carefully with a checklist and marking. Its feasibility is a little difficult because checklist has to be prepared beforehand. And but it is objective. It is objective. The examiner sees what the patient is doing. I have given an example there. For example, what's written there? A patient complains of stomach pain. How can you identify this when a candidate is examining a patient for stomach pain? In the end, if you write something, how do you know whether he is examined or not? So you have to sit there and watch. So like that, in a counseling situation, a student is counseling somebody. The examiner has to sit, not only has he to sit there and watch, and he has to have a checklist. I don't know how you're going to make the checklist in bioethics, but you have to do it. I think it's time that you start thinking yourself in one topic by one topic of bioethics, how to prepare checklists for practicals. Obviously, the advantages are the process and product are tested, variety maintains student interest and the examiner's interest also. There will be more faculty-student interaction. Moreover, in the formative setup, when you do, you know the common mistakes which the students do during that, and you can guide them, don't make this mistake, not at the end. I have seen examiners sitting at the end saying, no, 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 don't do that, don't do that. It's better to do it at the formative level. Okay, any more questions?
We have been talking about the objectivity in assessment and evaluation, but we don't seem to be implementing it. So I think somewhere we have to start, and whether ICMR could help us out in, because I think according to the university, yeah, we have been learning about it over and over again, but there is no practical implications
Madam, any comments?
of it.
Srimari, madam?
So,
about objective assessment,
Then
practical assessment in
practical assessment is being made more and more objective, and if we hope to be even more critical and objective in our assessment in future with the new revised curriculum coming in.
We have implemented it fully from 1998. We have implemented it. We are run up with problems now. But
Let me
that
tell
is
you.
another aspect.
Let me tell you my experience. We were doing pathology, and at that time, for the examination, for the first time, you know, I thought that pathology department was so modern in its outlook while evaluating. Sarah Varghese madam was our teacher, and every student know for the blood smear, the tongue shape, the stain, everything was given mark. So there was a chance, even if your smear is not tongue shaped, at least you get some marks in the other aspects. So it was started even at that point of time.
Let us come to a situation in bioethics. You ask a student to counsel a patient on, or a dummy on something. What are the checklist going to contain? So many things. Is he talking this? Is he telling this? What is his attitude? What is, okay. But then you have to be careful which are the most critical things, important things, which are must know in that. If he doesn't do that and does all the other 9 things, you have to fail him. So you have to decide the marks. Suppose there are 10 marks, don't give 1 mark for each thing. Must know areas that you give more importance. Like examining, doing a PV on a patient. If he doesn't wear the gloves, how much mark will you give? He may give all the findings correct.
Sir, I have a suggestion. Like if we provide the checklist and after that we provide a thing like remarks, that thing is going to be to serve the purpose, because there are many things, maybe some of them are not there, which the student feels is important to write. That things he or she can write in the remarks.
Oh, okay. He should be given a chance to write down something. Okay, that also is agreed. But you have to allot some marks for that. Suppose 10 marks, or some 3 marks and 7 marks. But mostly for a doing thing. When you test attitude, why you should write? If it is attitude and communication you are testing, it is observation. Primarily it's observation. If you want, you can ask them to write, but reduce the marks for that proportionally.